we're going to take a look at hemodynamics, which is basically the study of blood flow. Flow is directly proportional to pressure gradient and inversely proportional to resistance. So here's the formula that shows that. F stands for flow, the delta P stands for pressure gradient, and R stands for resistance. Now the pressure gradient is the pressure difference in two points, a place where the blood comes from and a place where the blood is going to. So you're always moving down the pressure gradient from a region of high pressure to a region of low pressure. If this difference in pressure is very great, then flow will be much faster. When the pressure gradient is high or increases, flow increases as well. When the pressure gradient decreases, when the pressure difference between 2 points decreases, flow decreases as well. So they move in the same direction because they are on the same line in this equation. Resistance, however, is below, and so resistance is inversely proportional to flow. So when resistance increases, flow decreases, and when resistance decreases, flow increases. Let's take a closer look at how pressure gradient affects flow. Usually pressure gradient is not an issue for the normal, healthy human. However, if a person has hypertension or high blood pressure in the pulmonary trunk or high blood pressure in the aorta, then what's going to happen is that the pressure difference between the ventricle and the pulmonary trunk, for example, decreases. The pressure gradient decreases, and so flow decreases as well. So let's say that the blood pressure in the aorta is higher than normal, then the difference in blood pressure between the left ventricle and the aorta decreases. So the pressure gradient decreases, and so flow decreases as well. There are three factors that affect resistance. They are vessel length, viscosity, and vessel radius. Vessel length has to do with how long a blood vessel is. If a blood vessel increases in length, what happens is that the blood must flow through it through a longer distance. So this would actually slow down the flow because the resistance has increased. So when vessel length increases, this happens when someone gains weight, the resistance increases as well. Viscosity, when that increases, it increases resistance. This is because viscosity means thickness. If the blood becomes thicker because it has more red blood cells or platelets, it can increase resistance. The third factor has the most profound effect on resistance, and that is vessel radius. This keeps changing whenever the blood vessels dilate or constrict, and the radius increases if the blood vessel opens up or is dilated, and it decreases if it is constricted. So the vessel radius has a negative effect on resistance. If you increase the vessel radius, the resistance goes down. Even if the vessel radius increases just a little bit, it can have a massive effect on resistance, which means flow is much greater. Here's a tiny blood vessel showing certain amount of flow. If this blood vessel is widened, the flow increases dramatically. So vessel radius has the most profound effect on resistance, which means it has a profound effect on flow, because when resistance decreases, flow increases. So let's review this real quick. Vessel length often has to do with weight gain. When a person gains weight, the length of the arterioles increases, thereby increasing the resistance. Viscosity is determined by platelet count and RBC count. And so when those things change or increase, it increases viscosity and increases resistance. Vessel radius becomes an issue when the arteries become somewhat blocked or partially blocked or fully blocked. Let's look at the factors that affect resistance and flow one more time. Remember that resistance and flow go opposite. When vessel length increases, as in weight gain, resistance also increases and flow decreases because it's opposite. When viscosity increases, resistance also increases and flow decreases. When vessel radius increases, resistance decreases and flow increases. Remember that vessel radius has the most profound effect on resistance, and therefore it has the most profound effect on flow. Now let's imagine that you have a patient who has arteriosclerosis of the common carotid artery. This is the artery that supplies the brain. If there is a stiffening of this artery, then this artery is somewhat blocked and there's increased resistance and decreased flow. So we'll take a look at how arteriosclerosis can lead to a decrease in blood flow. So here is arteriosclerosis. The artery has become narrower. There's narrowing of the artery. So vessel radius decreases. We know that if vessel radius decreases, then resistance must increase. So when resistance increases, blood flow decreases. One way to treat this is to introduce a stent. A stent is a coiled structure that, when introduced into the artery that has been narrowed due to cholesterol accumulation on the sides. So there's your stent, the little coiled white structure that you see. It actually widens the artery. It keeps it open, wide open. So how does stenting help to increase the blood flow? Stenting will widen the artery. When it widens the artery, it increases the vessel radius. When the vessel radius increases, resistance goes down. When the resistance goes down, flow increases and goes back to normal. So the main factor here is vessel radius. Now that we have learned about resistance, let's apply that to blood pressure. There are two main factors that affect blood pressure. They are blood volume and peripheral resistance. When blood volume increases, blood pressure increases as well. So the more blood you have, the greater the pressure. When peripheral resistance increases, it also increases blood pressure. Peripheral resistance is the same as the resistance that we studied earlier. The only reason we call it peripheral resistance is because we're dealing with blood vessels that are periphery to the heart. So when blood volume increases, blood pressure increases as well. When peripheral resistance increases, blood pressure increases as well. Now let's see how weight gain can lead to high blood pressure. We just talked about this earlier. When you gain weight, your arterioles and small arteries increase in length. This means blood must flow through these tunnels, little tunnels, for a lot longer time, which means that there is greater resistance. So here is weight gain. When there is weight gain, the blood vessel length increases. And when blood vessel length increases, resistance increases as well. Basically, peripheral resistance. If you've got a lot of blood vessels increased in length, then you're going to have increase in peripheral resistance. When peripheral resistance increases, blood pressure increases. For a lot of people, weight gain results in high blood pressure. Let's take a look at yet another example. How does high red blood cell count results in high blood pressure? So let's do a flow chart. When the red blood cell count increases, blood viscosity increases as well. When blood viscosity increases, we know that resistance increases. So peripheral resistance increases. When we talk about blood, we talk about it in terms of peripheral resistance. Peripheral resistance increases. And when that increases, blood pressure increases as well.